Good evening, guys, and welcome back to my channel again. And here with me again is
Nurse Chris. Nurse Chris Tomfawe. Yeah, that's it. So hope you guys enjoyed the last video we made about the stereotypes in nursing in terms of male in the nursing sector, in the healthcare sector. I hope you guys really enjoyed it. We have something, a blockbuster for you guys this evening, and we hope you guys would enjoy this particular topic.
Actually, last video was impressive because we got several commentaries saying it happened to them while they were practicing. They saw something like that, and they are tired of the old stereotype.
Yeah.
And one way or the other, I have to encourage them to continue what they're doing. We have several comments from Instagram down to TikTok, down to YouTube, and it was a very interesting moment. Even personally, people met us and spoke about it too. So it was an interesting video. But today we have a very nice content as regards to patient relatives, especially, and it will be divided into twofold. We'll have the attitude and also confidentiality. So let's just go straight into the video and then show what we have for today. So Chris, what can you say about how have you been able to manage rude patient relative? Have you been able to manage their character, their attitude when they come to you? How have you been able to manage it?
Okay, so the truth is, as humans, we have emotions. You get, and you will not see your loved ones in pain or in suffering, and we don't want to react. I get it, I totally understand. But then when it comes to the hospital, you should give your 100% assurance to the healthcare team that is responsible for rendering this care to your relative or something. Because one thing that I've constantly seen in my practice of nursing is how patient relative tends to react towards the nurses or probably the healthcare professionals when it comes to their relatives being in the hospital or being admitted for one issue or the other. They tend to exaggerate a lot of things. Yes, I understand the emotions behind everything, but then a popular saying that which says, if you constantly apply pressure on something without like thinking, you are reacting based on the anxiety that is within you. You won't get any result. It's just, for example, now something happens and you are crying. Instead of you to put in the work, do you understand? There's no reason making everywhere more anxious. Just relax and let the people in charge take care of your relative or whosoever you brought into the hospital. And secondly, I would also comment on we nurses, and if you check the scale, you see that most nurses are also rude. So there's reciprocation in communication. The two persons or the two parties, they are not animals. Do you understand? They are human beings. Do you understand? And so if you are able to communicate in a tone that the other person is going to listen and adhere to, there's no reason for quarrel, or there's no reason for you to be disagreeing with the other person. And if you see this in most cases, where even in the other industries, probably in a hotel, for example, now you see, for example, a customer will come in and have an issue, and they will be talking with the receptionist. The next thing you will hear the person say is, can I speak with the manager? Because they feel like the manager is more oriented, knows how to communicate better, knows how to, and that is one thing that is very much needed in the healthcare space. So I feel like, irrespective of the attitude the patient relatives give, we nurses, we should also be in that confined space of trying to communicate effectively to the patient, because nobody wants to be downplayed, nobody wants to be belittled. So the way you communicate with me is the way I'm going to react with you. Do you understand? You cannot be talking calm and the other person is shouting, and all of a sudden everywhere is already catching fire because this one is talking. Do you understand? Which does not really speak well of our profession. So it is better for me to speak or communicate in a tone where the patient relative will be able to understand that, okay, we are attending to the patient, we are attending to this person. All you need to do is just to relax. Don't be anxious for nothing. Just be calm. I understand the whole situation, but then You understand? Just try and just allay that fear and anxiety from them. But then there are some patient relatives that are up the roof. They are so the attitude is really porous. But then it still dwells down to communication for me. It still dwells down to communication because if you are able to communicate in a tone that the other person will listen to effectively, I don't feel like there should be any reason for chaos and all of that. So for me, that's how I'll be able to handle patient's communication, what do you call it, patient's attitude towards us and all of that, being rude and all of that.
Patient-relative attitude, actually.
Yeah, so that's how I'm basically going to attend to it. Just communication. You should be able to communicate effectively. So that's basically
that's lovely, because I think the bulk of everything lies on communication. As an healthcare worker, as a nurse especially, you communicate a lot to your patients, the relatives, to your fellow healthcare practitioners, like to many persons. So that is a key factor, effective communication. People don't know. I've noticed that people don't know how to speak a lot. People don't know how to communicate. People know how to talk, but they don't know how to communicate, because communication is a two-way system. As you are encoding, you're also decoding. So you receive, you encode, you decode, and then you make sure everything is going two ways. Not just talking, and not getting a feedback from everything. So that's a lovely thing from those scripts, because it's based on one end. I've seen angry patient relatives. I've seen how they can be very furious sometimes, because as I said, you said something about that. If your relative is in the hospital, or your husband, your wife, it brings that a lot of emotions, right? You're angry, you are scared, you're afraid. Like a lot of things happen to you at that point. So it's okay, it's justifiable that you are acting that way because you are human and you have emotions. So it's very, very important. But I believe that nurses, me personally, how I've been able to handle the fact that you have to be calm, you have to respond and don't react. They're already reacting to you based on the situation on ground. So I believe that as a nurse that you are, you should be able to respond to them. People are shouting at you. It's not a time for you to also shout back. It's not a time for you to lose emotion and start shouting at them back. No. It's a time for you to respond to their questions. For everything that a patient is saying to you, there's a question from everything. Don't just pick irrelevant statements from what they've said and answer those things. Pick up the few points that they need to understand. If it's that the patient is being taken care of now, they're already attending to her, they've given her medication, they've done so. Just make sure that you are giving strategic responses to them, and don't be on the roof with them, because in a boat, as I said, there can't be two captains. So in that space that you are in control. You are the nurse in control. And as you said, so many nurses have attitude issues, and it's a problem. So it's a problem. In as much as you see that relatives can be very angry. So when they shout at you, how do you respond to them? It's one thing that we need to understand, because so many nurses know how to react to people and shout back at that point. And I don't really, no. You don't do that. You don't do that. I know many people are not really cultured. Are not used to that system of how to respond to people. But I'm just telling you now, if you don't know how to do that, how you do that is to keep quiet. It's not everything you talk. It's not everything you make. Just allow them talk. And when they see that you are calm listening to them, they will be calm. They don't have choice to be calm. So, but when you are shouting, you are shouting, everybody, there's pandemonium everywhere. So, me personally, I try my best to be quiet and just let them speak. When they speak, whatever I need to answer from what they've said that is important, I answer and let it be.
So that's basically it.
That's basically actually.
Also, I noticed something online, I think on Twitter, where a nurse slapped a patient relative slapped a nurse. So in that case, what will you think? Like, what do you think should happen, or what do you think is the? Because when I saw that video, actually, I saw people actually reacting to it. Oh, I'm going to slap the person back. I'm going to do this. I'm going to do that. And watching that video, it brought a lot of I don't know how to call it. I had this kind of feeling inside, because first of all, what resulted in that? Yes, what resulted to the patient relative slapping the nurse. And for me, I don't feel anybody is a mad person. Irrespective of the fact that people have attitude issue. There's this Newton's law that states for every action there's an equal and opposite reaction. So for me, I feel like there must have been something that must have stimulated it. If a ball is on the floor, that ball cannot move except if something is acting on it. And so for me, I feel like before that slap came, what was being said at the back end of the OC, what was being said? Do you understand? I purposely did not want to respond to the video because of one or two reasons, but then talking about this now, I just want to just bring it up because some persons obviously will talk in the comment section or say something like, oh, what if this happens, what if this happens? And that is why I still rest on communication. Communication is very powerful, bro. Like, communication is, if you have that tool in your mouth, you can command a lot of things. True. As simple as the word is, communication, as simple as it is, you can command a lot of things. Do you understand? And so most people miss it. And to be honest, as nurses, just learn how to communicate. It is a very essential skill. It is an essential skill. Just learn how to communicate. May you not go collect slap when not be your own. They will sand your face. They will go collect slap. I don't know. People should allow them to seize your license, but then for me, I feel like, man, communicate. That's just it. So,
well, beyond communication, you know, we have to tackle the question: how do we manage such patient relative actually that tries to slap you or slaps you? You know, you must know how to de-escalate conflict as a nurse. That's one of your
very good.
You must know how to de-escalate, not escalate it, but de-escalate it. First they slapped you, right? And before they slapped you, there's something that you said, there's something that would have caused that thing to happen. It may be your fault as a nurse, it may be their own fault. So it's not just everything is nurse fault. It's also boiled down to how the patient took the situation. So they slapped you as a nurse. What should you do? You ask, why did you slap me? What did I do to you? And all those questions. And you see that they're still furious, and it's not a time for you to start talking back at them, because the more you talk, at that point they're already angry. They're trying. Everything you say to them is already itching them. Is already trying to trigger their emotions more and more. You report to your superior at that point, or tell your line manager that is currently there. Just make sure that you move from that situation that you are currently, leave that place, because staying in that place at that point yields to more problem. So when it comes to taking care of a person, sometimes you have to take them away from their location, because sometimes location can also contribute to the way your treatment or the way you can get better to a certain treatment. So imagine you're in a place whereby it's smelling, there are a lot of flies there are a lot of crazy bean and dirty stuff there. You can't get well. Because yes, one of Florence Nightingale's proposition in our theory is the fact that our environment
contributes to how our healing process is.
So this also boils down to how you must know how to deal with patient relative, because at that point they slapped you shouldn't start talking. Just leave that place at that point. If possible, look for somebody else to come talk to them, and that person has to be your superior or your line manager at that point. It's not for you to start saying, why you slap me? And because that's our natural response.
Not your patient relative shit. Want to do
that's natural human instinct to fight back, and that is normal. But
if you meet for outside now, that one did different. You know the way nurse uniform. You fit throw blow. You understand? You throw blow, give it teeth. Everybody, you understand? But
as nurse, you have to be wise.
You just
have to be wise, because you have a lot at stake. You know, very often I always say one thing, that if you come for me and I'm the victim, if I go for you, I see the victim. This one, you are the victim in everything. Like, you are like, they are not the victim, or you are the victim in everything. If they come for you, you are the victim. If you go to them, you are still the victim. You have something at stake, which is what your license.
And at this, apart from license, bro. Sorry to cut you short. Apart from license, we're in a social media era where anybody can just pick phone and just video you. First of all, if we're abroad or somewhere different from Nigeria, you know the system of Nigeria is already corrupt transport. But if we're abroad, if that video circulates, your license can be seized. Number one. Secondly, depending on the case, please take note. Depending on the case, your license can be seized. Secondly, if you want to go for job opportunities, if that video have circulated for several people or several zones, when they see it, they will not want to employ you. They will feel like you can't control your emotions. You can't manage your emotions, because first of all, it is not your organization. It is another person's organization. So the way the person wants to still keep his name running, he wants to still keep whatever services he is rendering running. So he cannot have someone from his facility behave to patient relative in such a manner and want to still keep that person. Do you understand? So for me, I feel like now that we're in a social media era, you should also try and manage, contributing to what you say in terms of seizing your license and everything. You should also try and manage your emotions around there. If this stuff we are saying happens outside, you are just wearing your normal mufti and everything. Like I said, you can throw blow, anything you want to do, you can do to the person. But as long as you are putting on a uniform and you are in a facility that is not your facility, you are not the owner of the organization, you are not the one running the organization, you don't know anyone running the organization, you are just an employee. I feel like there are a lot of things that need to be put in place. So you have to manage your emotions. You have to manage your emotions. Yeah, so that's just it for me.
Very important. I spoke about license being seized when something happens like that. Another thing is recognition from foreign bodies. Because you don't plan to stay in one place for too long. You don't plan to stay in one place like all through your life. You have to think beyond where you are currently. And how you do that is by seeking for jobs, opportunity out there, and a lot of opportunities that you can get from the international body. So you have to know how to curtail your attitude. It's very important. So we're done with this.
The attitude.
Part. But now we have another aspect of today's video, which is on confidentiality as regards to patients, because they can ask a lot of questions. You get like, what is happening? What is this? What is that? Now, today we would like to speak based on experiences and based on what how you're able to tackle such situations. Sorry about that. How you're able to tackle such situation with a patient that is being nosy, trying to know everything that's going on with the other person. Just cite examples for us.
Okay, so this happened about a few months ago. So there was this patient relative that came in with the patient. They came in together. Now, upon arrival, we took the patient sample, ran tests, and some other things. So when the test result was out, the patient relatives were there, and we asked that they excuse us from and they were like, he's my brother, this, that, and we try to explain why this is being done. That if the patient himself is willing to open up to you, that's fine. Do you get? So, but it is first of all the policy of the hospital. Secondly, it is part of the ethics in nursing that you should keep your patient's information
very safe,
confidential. So, for what I did that day was I tried to talk to them and let them see that, okay, this is the patient's information, it's your brother's information. There's no doubt about it. But then I would like to tell him personally first. Then if he chooses to want to open up to you people, that's fine. Do you understand? If he chooses to want to open up to you people, that's fine. But for now, I feel like we should be the one to pass the information to him first. Then if he feels like, can tell you guys. And they understood perfectly well. And another thing again, you don't have to be too serious. Do you understand? These were men. I know how to relate with them. They are my gender, so I know how to relate with them. Do you understand? There's a way you relate with them, and that's why I talk about communication. There's a way I related with them, and they just understood what I was saying. And the next minute, they said, okay, no wala, talk to him and let's find out what's going on. So we told the patient. When the patient saw that the result was okay, said there was no reason for him to now withhold the information. So he had to tell them. Do you understand? Secondly, there was a case in the hospital where I was working before as a student nurse. I was asked to do a VE for a teenager, a VE for a teenager, and she said she was experiencing some discharge and some, which we asked normally. The doctors asked, "Are you sexually active?" You know, those questions that come in. But then, you know, probably she was in the presence of her parents or something. The fear was there, and she was not able to really voice out that, okay, I've actually been sexually active. Do you understand? But then her mom can choke her right there. You just say, yes, I'm sexually active. Like, you just imagine the situation. You are with your mom and the doctor is asking you, are you sexually active? You understand how the tension will be, as in sweat. You start sweating on usual places. Do you understand? It be like say they ask you exam for your final year exam. You will start sweating on usual places. So at that point, the next thing, she actually lied that she was not sexually active. So and normally if you're not sexually active, they what they call it, they don't introduce something into, because you can damage the hymen and they can literally sue you for that. So upon arrival, I cleaned the surface and noticed that this thing is opened. Do you understand? From my observation outside. Then I called the doctor personally inside and told him, sir, please, you self come and take a look at this. And mind you, please, as a male, always take a chaperone. Always take a chaperone. Very essential. Very essential. Because
you raped me.
They will ask me, I'm not due. I live in my mama born. Maybe not seize my license. I'm not due. Yeah, you understand? So you always carry a chaperone. So the chaperone was with me that day, and I called the doctor. The doctor, we examined and everything, and he asked the girl again, but her mom was not there. And she opened up and said, okay, yeah, she's actually sexually active and all of that. And obviously, you know that the mom will be waiting for, of course, the result. She want to hear, what did you people find? Because for the girl to say she's experiencing discharge, meaning that something must have happened and all of that. Probably an infection or something must have been introduced, which is not supposed to be introduced, per vagina and all of that. So we came outside, questions were being thrown. At that point, I will not even lie to you, I did not know what to say. I had to now direct the woman, please go and meet the doctor. The doctor will give you more information about it. Do you understand? That's on that way to dodge something. I don't know, not the safe person. At least when I was small that time, my mom usually tell me, I don't know, not the safe person for problem. I don't know, just say I don't know, because if you, the moment you gotta talk one sentence like this, you want to find out. So I said, to be honest, the doctor will give you more review about it. For now, I think everything is okay, but the doctor should know better to explain things to you and all of that, because the girl actually begged us not to tell her mom about the whole thing. But then I think there is this rule that came up one time, that if it's such a thing that is going to cause harm to the patient, in-depth harm to the patient, that you can let the patient's parents in on the issue. For example, if it is a 16-year-old or an 18-year-old, obviously yes, he's a teenager or he's an adult. Yes, according to Nigeria standard, according to law, he's an adult. But then you are still staying under your parents. Do you understand? So there's a certain level where your confidentiality can get you to. But when it's now causing in-depth harm to you and probably to whosoever is around you, I feel letting the patient's parents in or guardian in, I feel it's something to want to do. So for the girl, I just directed her to go and meet the doctor, and her mom to go and meet the doctor. So whatever the doctor discussed with them, that was their take. I really did not partake in that one, but it was something I experienced, and like I said, I don't know. You can also just go and meet the doctor to explain better for you, rather than you going to make sentence and you get. So most of the times is that I also have some other scenarios where I've had to try and explain to the patient about some certain things, but I can't really wrap my head around most of them now. We get to experience these things most of the times, and sometimes you don't even think about it because of your other activities that you have in front of you. So for these two, I feel like it's something to take note of. So what about you?
Bro, from your own part, that story was very funny and very, very educative. Because see, if you're talkative, you can't do nothing. You're someone that talks a lot. Just small gist with your friend, you can just void that information. They don't do that one in nursing or in medicine.
They don't agree for you.
No, you don't do that. So that's something you must learn, and this is just to student nurses or maybe a nurse. The fact that your friend is your best friend does not mean you can speak everything about your workplace or your patient to them. No, because even though a king or a celebrity is in your hospital and your best friend asks you what are you diagnosed of, you can't say nothing.
If they let they bribe you with money,
you can't say nothing for real.
If you try it and they catch you, jail.
The moment you said I do, and you were swearing to the oaths on your induction day, you are really doing, because you can't escape punishment. So that was a profound experience, because for real, I know what it means that children nowadays and even in general,
this generation, I God go help them.
They can be.
We help us help them.
Oh God, they can be something else for real. But
17 years already having sex, 16 years safe.
Things be happening. Things be happening. So from my own end, I've experienced something before, and now that the man would, I think this was even the brother on out in our brothers.
Yeah.
They were asking, the brother came in and they were asking, what is wrong with our brother? And they were asking, and we're like, you have to just hold on. If possible, when we are done with him and he's stable, we can tell you what.
Yeah, we can properly explain to you what's going on.
But from our own end, we can't do that. And that's what I also experienced before. Even though this thing I'm going to say now, he would know about it. Whereby you can't be so careless about your patient information. That this also boils down to their folders, boils down to their case notes. You can't be careless about it, because the patient can just walk in and just look at it, and when you look at it, you might not be there at that point, and look at it. The fact that you're not there does not mean that you're not responsible, because you're the nurse on duty. So if they see what they need, they can what they should not see, and they've seen it already, and it's not causing issues with their partner. That's already a problem. So I don't want to explicitly give the example that happened, but based on your patients, everything that concerns them, both their next of kin, both their name,
everything should be confidential.
Their husband cannot know about it, except the patient goes ahead to tell him about it. So there are so many cases, so many cases. I don't have so many rough experiences like he said, because that scenario case was something else, like for real. It's crazy.
Funny how I just remember on that scenario. So there was this time, I got most of my experience from outside, not majorly this hospital, where I was basically working before.
Yeah.
So there was this woman that her husband was sick for several months, and they kept on going to the hospital day in, day out, and the wife was constantly spending money. The husband was spending his own money too. So unknown to the woman that her husband had HIV, and she did not know. Do you understand? Her husband had HIV and she did not know. And so they went to the hospital. Even after, for the several months when he has been sick, the doctor on ground usually tells the wife, oh, is malaria, is this, just gives like a brief random treatment and comment about the whole sickness stuff. But the wife kept on wondering, like, what's going on? And they kept on, they have a particular place where they attend to them. So that day, the particular doctor in charge of the man's case was not around.
Oh.
It was another doctor. And so, by the time they rushed the man in to the hospital, and by the time they rushed the man into the hospital, and they came, the doctor asked the woman, "Oh, can I see you in the office?" and all of that. And we were just talking and everything. And the next minute, the man was like, the HIV has spread so bad and all of that. The woman was so shocked, like, HIV? Like, who has HIV? Say, your husband. Say, no, we have been coming to the hospital for several months now. And the other doctor, that was when the other doctor, the current doctor that was there, that passed the information, knew that he fucked up.
Hey.
At that point, he knew he had fucked up. He has messed up. Do you understand? He had messed up. So, at that point, the woman passed out because of the information. Do you understand? She passed out immediately because of the information. Now, for me, I was not directly in contact with that stuff, but then seeing how it happened gave me a whole lot of understanding about this confidentiality thing. Now, another thing, I wanted to say something before this. So, if you want to attend to your patient, or you want to explain a test result for your patient, and you are trying to excuse the patient's relative, and the patient insists that the relative should stay there, sometimes it is a setup. It's a setup. I'm going to come back to this. Back to the what they call it. Back to the patient. Back to the patient, which the doctor who passed the information to the lady, and she fainted. We now started doing resuscitation for that one. Do you understand? We started doing resuscitation for her. So for me, what I picked from there is, number one, how you pass information matters. First of all, number one. Secondly, you cannot be married to someone, you have such condition, and you are directly, because this one is directly, you are directly in turn going to harm this person with whatever you have, and you are still telling the person to keep it confidential. For me, I feel you are a bad person.
Wicked.
You are a wicked person, because you have such a thing wrong with you. Do you understand? Yes, we know it's a very sensitive sickness or something, but then there's no harm telling this person, because you don't want to now start sharing this thing with another person. Do you understand?
Yeah.
And secondly, I blame the doctor, the first doctor, for not properly educating this man, to educate him enough to open up to his wife, because you cannot imagine that woman, because at the end of the day, they tested for HIV, but she did not get it. Do you understand? She did not get it. But then you cannot in turn be putting somebody else's life in abject danger, because it is wrong. In all sense of this thing, it is wrong, because I feel from the very first person we need to look out for is the first doctor that came in contact with that man. You should have been well educated enough to educate that man about the possible dangers that can occur if you engage in such activities with your wife, knowing very well that you have something as deadly as that living within you. Do you understand? Then secondly, the doctor on ground, the doctor that passed out that information, I feel like before we do something like that, we have doctors handing over to doctors. You can look at case file, you can see what is going on in the case file, then from there try to find out how you are going to pass the information to whosoever you want to pass the information to, because they did a very careless thing there. They are putting the woman's life in danger, because we don't know if that woman has a heart condition that you passing that information to her can just quickly enter cardiac arrest. Do you understand? I've literally seen people who just through information that they just passed to them, they'll just pass out from there. Do you understand? So I feel the way you educate your patients concerning something really matters. The way you pass your information out really matters for that. Coming back to the other one where I said that a patient telling you that, oh, you're really they want the relative to there. Sometimes it can, not all the time. Sometimes it can be a setup, because they will not want to feel bad in terms of you telling that their relative to go out. So they will want to now put their mouth is like, no, you can stay now, you can stay. But deep down, they don't want that person to stay. But then in turn, sometimes when you now leave, they feel like when that person comes in, it'll be like, so you tell the doctor, say, make I come out. You understand that kind of scenario can occur. So most of the times, it is a setup. It is not for you at that point, for God to give you knowledge, to give you the wisdom like Solomon, to now discern and say, okay, this is what I should do in this situation. Man, I know very well that you're supposed to be here. I know very well. But then, I feel like, let me just do what I need to do. Let me pass out the information. When you come, when I'm done, if she wants to tell you, she can tell you, okay, please, I'm begging you, I beg, Joe, whichever language you're going to use and tell them, just find a way, playfully, just do it. Because to be honest, if you say that thing and it's a bad result, hey,
even the patient will deny you.
They will deny you, mark your face.
For real.
See, as in, what did they use your eyes see? Oh shit!
You will be denied.
You will not believe it. So most of the times when they will say, I can stay, I set up, because they will not want to feel bad when that person is going. Because they will know that when that person comes in, the person will obviously ask them, what did they tell you, what did they do? Do you understand? So use your number 6 most of the time. So that's for that.
So oh god, today was really awesome, and thank you again, Nurse Chris. It's always nice having him around, because it's always an insightful conversation, and you've learned about how to deal with angry birds relatives. You've learned that, and you also learned about how to handle confidentiality while dealing with patient relatives, because these are sensitive matters in the space of nursing. So thank you all for watching, and we hope to see you in the subsequent episode, because we are cooking a lot for you guys.
We're cooking a lot for you guys.
See you all.
Bye. Take care.
Peace out.